Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Torrell Hebert, Patient Services Manager, and Bailey Porche, a clinical dietitian at Terrebonne General Health System. We'll be discussing MyDining, a patient meal ordering system that ensures to increase order accuracy and patient safety. Welcome to the show, ladies.
Thank you.
All right, well, Bailey, let's start with you. Can you tell us a little bit more about your role at Terrebonne General?
Awesome. I'm the clinical nutrition manager. I have been at Terrebonne General for 3 years and a registered dietitian for 4.5. And so I've had the pleasure of taking part of this MyDining experience with Terrell in my new position.
Okay, and Terrell, tell us about what your role is here at Terrebonne General.
So I've been here at Terrebonne for 16 years, with the last 5 years being in my current role as Patient Services Manager in the Food and Nutrition Department.
Okay, and y'all just launched an exciting new product for our patients, so let's get started talking about it. Terrell, can you tell us what is MyDining?
So MyDining is a Morrison Healthcare meal ordering system that takes the patient's menu selection and it increases patient safety, ordering accuracy, and patient satisfaction.
How does the process work?
So the MyDining system is integrated with our recipe database, and it automatically updates real-time information such as patient room, diet orders, allergies from our EMR, and it gives the associates the information they need to offer a variety of menu items that the patient can have on their prescribed diet.
Why was the program implemented?
The MyDining program was implemented to increase tray accuracy while making sure the patients receive safe meals throughout their stay. And it's also for great tracking measures to monitor trends to improve quality.
Okay, and Bailey, how are food restrictions handled?
So when obtaining menu selections, items that are not allowed on the patient's physician's prescribed diet, they just won't be available to be selected. So on the associate's iPad, instead of the original item that is no longer appropriate, an alternative will be there, or it'll be grayed out and just be unable to be selected. And this goes with allergens or hidden allergens as well. They just will not be able to be selected to potentially accidentally give to a patient, where the goal is to prevent that.
Yeah, exactly. So what are the nutritional benefits?
When the patient receives their meal tray, they also get a meal ticket, which is really nice because it has all the items of the tray, but at the bottom, it's almost like a nutrition label. It has calories, protein, carbs, fat, sodium, potassium, all that good stuff for that meal. It kind of just breaks down the nutrition, and having this available to the patients kind of reiterates what they may have been working with the dietitian to learn.
So is this option available for guests also?
Yes, the patient guests can purchase their meals ahead of time through our cashier's office, and then our associates just handle their ordering the same as our patients.
Okay. And Bailey, what does this do for the patients?
So it just drastically helps decrease the margin of error with potentially serving our patients something unsafe, especially like in the sense of allergies, potential allergens, or hidden allergens. This is done so because our system is automatically updated every time the menu or recipe changes or a product's ingredients change. It can be updated to allow us to know everything that's in everything. And just our associates get real-time information from the EMR. So they know when, as previously mentioned, the diet changes, allergens are added or removed. Like, it's just that the information is at their fingertips and quickly. So it's really awesome.
Right. And when you say EMR, what does that stand for our viewers?
Electronic medical records. And here at Terrebonne, we have Epic.
So what are some positive comments that you've gotten since using the new system?
We've gotten a handful. A lot of patients really like the nutrition information at the bottom of the tickets. A few patients have thought the iPads that the associates carry around are pretty neat. But also just the patients are getting to kind of talk through their diets a little bit more. They're getting to kind of see what the dietitian had been talking about, getting to talk through it with the associates on just the components of their meal. So it's really neat. It's just a new topic brought up.
Mm-hmm. Right. And what were you doing before?
All paper,
So this is
all manual, yes.
and this is all electronic. And you, like
Yeah.
you said, it's interactive with the patients, right?
They're allowed to kind of build their menu, like their meal a little more. Like they can work with the associate to go back and forth on getting the appropriate amount of carb servings per meal. If it's too much, they can work to kind of exchange it out. It's just, it flows a little easier than it did previously.
Yeah, so if we had today's chef special and you ordered the Salisbury steak, green beans, mashed potatoes, with a milk and a dessert and the roll, that would be too many carbs for your meal limit.
If you had a diabetic diet.
If you had a diabetic diet. So one of the things that the system does is allow the associate to look at talk to the patient and, okay, we're at the carb limit. So do you really want the dessert? Do you really want the roll? Can I swap out the milk for a light lemonade and make choices right then and there?
Right, and be conscious of your intakes.
Yeah, just
Well, that's pretty cool. So what are some main takeaways you want the audience to know about MyDining?
we've just worked really, Terrell has worked really hard to implement this program for us, and it's a long time coming. It's been a great experience.
We
What's your-
worked a long time to get everybody trained, and our training process went smoothly. The staff really likes it.
Well, thanks for being with us today, ladies, and rolling out the latest and greatest technology to our patients.
Oh, thank you for having us.
Thank you.
For more information about MyDining, visit tghealthsystem.com. I'm your host, Rhonda Alford. Thanks so much for being with us on To Your Health, and I'll see you right back here next week.